Senate Democrats have reportedly cut about $400 billion now off of their health care proposal, bringing the $1.6 trillion price tag down to just $1.2 trillion. That's still more than most lawmakers are willing to spend, no matter how that cash is raised. Utah's Republican Senator Bob Bennett serves the Banking Committee and as counsel to Senate Minority Leader Mitch McConnell, and has been working very closely on a bipartisan health care bill. Senator, thanks so much for joining us. First of all, we began to see a little bit of crack in the concrete around the president's feet on the subject of a public option. At least that's the way I read what he said at his news conference yesterday. Were you picking up that signal, and is that good news as far as you're concerned?
Well, yes, it is good news, and yes, I have picked up the same signal, not only there, but from conversations with some friends that I do still have in the White House. The thing that has jolted the Democrats in general, and the president in particular, is the huge price tag. And they recognize that if they cannot turn the cost of health care, turn the curve of the cost of health care downward, even if they can get over the cost of this program, the long-term implications for Medicare and Medicaid are still huge for the economy. So money is now the driving factor in all of the decisions that they have to make.
But there's also a moral question about nearly 50 million people who are not covered. And under your plan, the Wyden-Bennett plan, you would still have so many million people, I think 36 million people, not covered by 2017? Correct me if I'm wrong.
Yeah, Wyden-Bennett would cover everybody, I think, after the transition period of the first 2 years. We have an individual mandate, and we think that's the way to go, and everyone in the country would have access to health coverage.
But the individual mandate would mean that people would be having to lay out money.
That's correct. Somebody has to lay out money for health care. Doesn't matter what plan you talk about, somebody has to lay out money. And we changed the tax laws so that the employers could give you the money they are currently spending on your behalf for health care, so that you can spend it on your behalf for health care, only would not be taxable to you. So it would stay the same as far as the tax laws are concerned to the employer, but it gives you control of the money instead of the employer, which means you can then go into the marketplace with clout that you currently don't have.
Senator Kerry said this morning on Morning Joe that he didn't know why you all have to come up with something that's revenue neutral from the get-go, that the savings could come in the out years.
The savings never come in the out years. The out years are always more expensive.
But what about the savings that the president has projected, and he has cut deals with pharma and other interest groups, $80 billion announced on Saturday. What about those savings that he says will come from better rationalizing the system?
They quite frankly, they're all speculative. They have not been scored by anybody who has really looked at them in depth. And while 80 billion sounds like an awful lot of money, 80 billion coming off of 1.4 trillion, the 1.4 trillion number could be off by a very small percentage and eat up that entire 80 billion. We're playing with headlines, we're playing with political slogans, rather than dealing with the realities of healthcare. And one of the main realities of healthcare is that our present system is badly broken, needs to be dealt with fundamentally, and the president and the committees, frankly, are tinkering around the edges. The only people that are going after a very fundamental change in the way the system is structured is the Wyden-Bennett bill.
Senator, I wanted to ask you about Citigroup offering or contemplating pay raises of as much as 50% to their employees. You're in the Banking Committee. They took federal money. Is this appropriate?
I don't think it's appropriate for the federal government to start setting wages. And I don't know whether those people truly earned it, whether this was an incentive which, if it had been canceled, would have changed the earnings of the company. I've been a CEO. I've had to make decisions as to who gets money and who doesn't. And in my company, there were plenty of circumstances where some of the salespeople earned more than I did. And I was perfectly happy with that, because if they hadn't made the sales that produced that kind of result for them, I, as the CEO, wouldn't have had a company to preside over. So I want to look at the details of this I won't say blanketly no, 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 but I'm very, very nervous about the idea that the federal government should come in after the fact, after a successful year, and look at where the people are and say, oh, you're paying these people too much. We, in the name of the taxpayer, will say no. You run the risk of doing serious damage to the company with that kind of activity.
And before I let you go, Senator, what do you think the chances are of a bipartisan agreement on health care and of actually getting something done?
I'm an optimist. I will never say never. I think the reality of the scoring that's coming out of CBO on what I would call the Democrat-only bills makes it clear that a Democrat-only bill is not going to pass, because there are a number of Democrats look at that number and recoil against it. So if you're going to get the number down, you're going to have to deal with some Republicans who have ideas that can get the number down, and that means, I hope, you're going to move towards a truly market-based solution instead of an academic government-based solution. And if we do, yeah, I think we could get a bill.
All right. On that note, thank you so much, Senator Bob Bennett. And in less than an hour, the president will sit down with several governors to talk about health care. And when he does,